Hi, this is Dr. Sushma Sukriti, consultant dermatologist at Anaha Derma and Ortho Clinic. So today we'll be talking about pregnancy skincare. So when you become a mother, your body tells a story of love, strength and the miracles of life. So this video is for all those beautiful mothers who want to take care of their skin during and also after your pregnancy. So we all know that pregnancy is a special condition. Your body is changing, so is your skin. So there are certain ingredients you must be avoiding during your pregnancy. So let's see what are those. Firstly, retinoids. So vitamin A derivative, high levels in your bloodstreams can cause birth defects. So it is a strict no. Now next comes your salicylic acid. It is an amazing exfoliator and we all know that, but in pregnancy it can lead to complications as it can cause salicylism in the baby. Now the third one is hydroquinone. So it is used to treat your dark spots and hyperpigmentation, but when it is absorbed into your skin, it might increase the risk of adverse events in your pregnancy and also into the baby. Next is your Arbutin, which is also a derivative of hydroquinone. So when applied on the skin, it usually changes to hydroquinone and hence must be avoided. And the most important is sunscreens. What is available in the market is chemical sunscreens, actually harmful during your pregnancy, at least in the first and the second trimesters, because these chemicals can actually be absorbed into the bloodstream and reach the fetus and cause issues during the embryonic development. So we usually ask the patients to prefer using your physical sunscreens, which actually contain titanium dioxide or zinc oxide. Discussed about ingredients that we should avoid. So if these are all the ingredients that we are avoiding, then what can we use in order to maintain our glow and healthy skin? One of the ingredients is hyaluronic acid, which actually deeply hydrates your skin, keeps it soft, plump and moisturized. So it's your go-to if you're struggling with dryness. And then comes your niacinamide. It's an antioxidant. It helps to decrease your pigmentation, it improves your skin barrier, evens out the skin tone, calms the redness and also helps in controlling your excessive oil and your acne. Then comes your vitamin C. Now vitamin C actually brightens your dull skin and helps fade your pigmentation. So look for a very gentle vitamin C serums, somewhere that is less than 10% during your pregnancies. And be careful that your vitamin C does not oxidize, because oxidized vitamin C can make your skin more dull and pigmented, and please top it up with a physical sunscreen. Then comes your azelaic acid. This helps to fight your acne, it helps to reduce your pigmentation and also soothes your inflammation. A very good go-to for your pigmentation during pregnancy and also your acne. Now comes your ceramides. So just like your hyaluronic acid, your ceramides also help to keep your skin healthy and moisturized. It also improves your skin barrier and helps to reduce the dryness and also can help you with your stretch marks. Then comes your glycolic acid. Usually we tend to avoid it during the first and second pregnancies. A great ingredient for reducing your pigmentation, helps you with a good glow and skin tone and texture, but we want to keep it less than 5%. There are a lot of pregnant women suffer with pigmentation during pregnancies. Now there could be various kinds of pigmentation. You could be having darkening of your neck because of your hormonal issues, or you could be having something known as linea alba that is usually present as a straight line across your abdomen. Then you'll see darkening of your other areas, your flexural areas. It is probably because of hormonal changes. And one more most important thing is pigmentation that you see usually on your cheeks, your forehead, upper lips, your melasma usually. In pregnancy, it is called cloasma or the mask of pregnancy. It is seen around 50 to 70% of the pregnant women. So this happens because of your hormones like your estrogen, progesterone and your MSH, which trigger the excessive melanin production, and sunlight makes it even worse. So the most important thing that you should be doing during pregnancy in order to prevent this is to look for a good physical sunscreen, giving you a good UVB and UVA protection. So your physical sunscreen ingredients that you should be seeing are zinc oxide and titanium dioxide. So you should be applying it every 2 to 3 hourly, and the quantity will be 5 fingertip units for the face and 2 for the neck. And please avoid going out in the peak sunlight. And you can use certain ingredients in order to control the pigmentation, such as your vitamin C serums or your azelaic acid or your niacinamide, which can be gentle and helpful throughout all trimesters of pregnancy. So another important condition we see is stretch marks during pregnancies. So this is usually occurring around your abdomen, your belly region, your thighs, calf region, your upper arms, your breast region. So these are common areas we see. So stretch marks usually are common during pregnancy. That is because of the expansion of the skin in order to accommodate the baby and because of the weight gain that is happening during the pregnancies. So avoiding weight gain is not possible, but you can maintain it to a healthy levels. So probably avoiding excessive weight gain quickly is what we can do. That is by eating balanced meal and avoiding too much junk and food that is nutrient rich, which is also helpful for the baby and for your pregnancy. One more will be to stay hydrated. Drink at least 2 to 3 liters of water daily. Hydration keeps your skin elastic and prevents the tearing that is happening. Then, like we discussed, we need to have a balanced diet which includes proteins for collagen development. Then you need vitamin C for repair, vitamin D and zinc for skin strength. Then to moisturize daily is very important. Always moisturize your abdomen region or your belly region, your thighs and your arms, and wherever you see the stretch marks thoroughly, because this can actually help prevent your sunscreens to some extent, or even if they come, they may not be too excessive or too bad to see. So the ingredients we need to be looking for in your moisturizers are your cocoa butters, shea butters, almond oil, your Centella asiatica, then your hyaluronic acid, your ceramides. These actually help with your barrier repair and also help in moisturizing the skin well. Another thing is to stay active, as your skin will stay firm. Do light exercise or prenatal yoga that is approved by your doctor. It improves your blood flow and also helps with your stretch marks. So what to do if you already have stretch marks? So if you already have them, then this becomes a little difficult to treat with only creams. Then you'll have to go for procedurals that will help with your stretch marks, which cannot be done during pregnancy or immediate postpartum. That is at least for 6 months or 1 year till you're active breastfeeding. So post breastfeeding, we can give you some retinoid creams or certain ingredients in order to reduce stretch marks that will help to boost your collagen and increase cell turnover and improving your blood flow. And we can look at certain procedures like your microneedling, radio frequencies, or your fractional CO2s that can actually be helpful in these. But one thing is that stretch marks require a very prolonged treatment. They usually do not disappear probably in 1 or 2 sessions. You probably need 5-6 sessions. We need to see how it is improving, and then to top up with these laser treatments, we can even give PRPs in order to hasten the improvement and cause some collagen stimulation. The one thing we should remember is no matter what procedures we do, we cannot make your stretch marks completely invisible. We can only make your skin smoother and make the stretch marks appear lighter and less visible.